The following is an independently produced program. The views expressed within are not those of WSRF 1580 AM, their staff, or management, but are strictly those of the hosts, guests, and callers.
Nous commençons une nouvelle année et c'est moment pour nous travail nouveau, plan nous. C'est peut-être ça, Caballero Rivera a offert un spécial extraordinaire, moi ça, pour aider à planifier. Avec seulement 2,5% de dépôt, ou qu'à réserver un espace cimetière pour ou ak famille ou. Dans un espace tranquille dans site Floyd là. Léo planifier bonheur dans moment difficile ça, li ba ou avantage pour pas porter bot blé devant tout le monde. Spécial ça, pape dire pour tout temps. Relais Kathleen Bao, jodia na 786 253 0211. Pour plus d'informations, pour qu'à assurer espace ou. Numéro encore, c'est 786 253 0211. Caballero Rivera, planifié jodia pour la paix, l'esprit demain. Each day, the cost of living is increasing. It is the same as funeral and cemetery costs. Pre-plan your arrangements today and save your family the stress of finding the money later. Finance your plan up to 7 years with low down payments and affordable monthly payments. To set up your appointment, call Kathleen Barreau at 786-253-0211. 786-253-0211. Chat with Kat, chaque mardi from 6 o'clock to 6:30 p.m. discussing finance, mortgage, assurance, funeral care sur WSRF 1580 AM and 99.5 FM avec Kathleen Bao. Nous là pour connecter avec toutes les ressources financières qu'a aidé à grandir. Good afternoon, bonsoir tout le monde. You are listening to Chat with Kat on WSRF 1580 AM and 99.5 FM. We are also streaming live on YouTube and also Facebook Live as well. We have a very, very special guest today that is joining us all the way from Miami Beach. She has a practice in Miami Beach, actually off of 41st Street. And I'm going to introduce her and let her tell you a little bit about herself. Her name is Dr. Rachael Nambusi. Thank you so much for joining us today. Welcome to Chat with Kat.
Yes, thank you. Thanks for having me, Kat.
You're most...
all mine.
Oh, you're most welcome. You're most welcome, chambermate. So Dr. Nambusi and I, we are part of the Miami Beach Chamber of Commerce. And as I mentioned in last week's show, I wanted to highlight Black excellence in our community since this is the start of Black History Month. And what way to start the month by having a powerhouse of female energy on the first show of the month. So welcome again, Dr. Nambusi.
Awesome. Glad to be here. And hello to our viewers. So everyone that's listening in, it's a pleasure to be speaking with you right now on the Chat with Kat.
Perfect. So let's get into it. So to start, can you tell us a little bit about yourself and what role you play at MHW Medical Group?
Yes, certainly. By the way, MHW stands for My Health and Wellness. That's exactly how we want our patients or clients to think about us, as their health and wellness medical group. I was able to come up with that just because of our mission, which is to serve and support people in their health and wellness journey. So if you're looking to optimize your health, we are your medical group. We're here to serve you. Again, like Kat mentioned, we are located right here in Miami Beach, right off of Sheridan Street and 41st. So you're welcome. You're very welcome.
Perfect. And what role do you play at My Health Wellness Medical Group?
Yes, I'm the lead consultant here. I'm the physician and the owner. So if you're coming here, you're going to you will certainly meet me. So I look forward to meeting everyone. I am the physician. I'm here full time. So yeah, really, really excited to be here.
Perfect. So Miss Rachael, what inspired you to focus on wellness and preventative care in your practice?
That is a great question. So, a little bit of a background for me. I'm sure many are wondering. Rachael Nambusi. I am originally from East Africa.
Mm.
I did my medical school here in the United States, part of it in the Caribbean. I'm a tropical girl, so why not, right? And the rest
Mm-hmm.
of my clinical experience was right here in Miami between Jackson and Mount Sinai is where I did all my clinical work. And after that, I went on to a lot of traveling. So I did a lot of locums work. I worked as a hospitalist for over 8 years, which is something I like, coordinating patient care. I like to be the patient's primary person to help them coordinate. I mean, it's hard enough feeling unwell. So in the hospital setting, I got to admit patients right from the emergency room. I take care of you while you're in the hospital as a hospitalist, navigating your care, whether you need surgery or just cardiology or just coming through for regular visits. So I did that for several years. One thing I realized is certainly we do all this amazing work in the hospital and discharge patients back to our communities. And oftentimes a lot has happened, you're not in your natural environment, it's stressful as it is. It's our job to make you feel at home, but obviously we want you to go home. Now, a lot of our patients went home, and because of maybe the confusion or the transition of care, oftentimes they will be back. Maybe it's confusing language from the hospital, or you're just not feeling well because you didn't get a chance to connect with your primary provider on the outside. So a lot of people ended up coming back into the hospital. So already our healthcare system is stretched. It's very expensive. It's just not what we should traditionally be experiencing. If we're all doing our job, great. So after getting tired of having people just shuffling through the door, I decided I was going to be that person on the outside coordinating care to help keep people from having to go in the hospital unnecessarily. And hence the birthing of my health and wellness medical group.
Awesome. So I noticed
Yeah.
that the medical group focuses or emphasizes on holistic approach to wellness. Can you explain what that means and why it's important?
Yes, certainly. I'd be glad to. So we do a lot of preventive care here, or the holistic approach is really, yes, people need their acute care or Western medicine, but ultimately our bodies are that machine that once well taken care of, we can activate it to heal itself, to take care of it. And so we have a lot of innovative solutions here to help our patients not be addicted to the other medications or the traditional Western medicines we're used to using. So we want to do that by incorporating preventive measures. We educate our patients on how to take care of themselves and provide these innovative solutions so they ultimately can maybe put off surgery or not even require surgery or heal better after a surgery. Or whatever ailments or chronic conditions they have, how can we emphasize prevention? Or if we've already had a chronic condition, how do we empower the patient to be able to take charge and not be so dependent on medicines? That's a question I always like to go through with my patients as they come over for consultation.
That's good to know.
Yeah.
Now, many people think that healthcare as treating an illness, but My Health and Wellness focuses on prevention. Why is prevention care so critical, especially in today's fast-paced world?
Well, it's always best to prevent and try to cure. This is how we're going to be able to stave off those chronic conditions by preventing. So, the things we're eating, the exercise or the movement we're doing, we're really diverse here in that, whether it's occupational medicine. Take, for example, during the pandemic, right? We were all busy trying to take care of ourselves and do our jobs. So hence the birthing of telework. We are seated indoors or on computers all day long, not what we're meant to do, right? So even if that's the situation, how do you prevent the body from just getting really dormant and stagnant, right? We're not getting enough sunlight, or we're seated. I mean, people are having back issues just because of the nature of work. So prevention, I like to think of whether you were healthy and don't have a condition, how do we prevent you from developing a condition? Whether it's by your nutrition or your habits, exercise, physical fitness, or just mannerisms at work in your regular environment. We all spend several hours working every day, so that's another place where to apply that prevention. One of the other things I did not mention, I'm a flight surgeon with the U.S. Air Force, and my main job there is really to take care of airmen or service members or our military members to prevent them from being unwell or being harmed by the work they do, or to make sure they're fit to fight. That's exactly what I want to do for my patients out here. So that's always exciting, and that's an area I'm very passionate about, prevention.
I love that. I'd like to hear how passionate you are about preventing illnesses from even and being initiated with your approach. So, what are some common misconceptions that people have about wellness, and how does My Health and Wellness Medical Group address them?
I think one of our key ingredients here is we like to look at a person as a whole being, right? Um, Making sure that we are incorporating, say, your nutrition in there, making sure that we are looking at you, not just this one condition that we have, but as a whole person, what's impacting, what's leading to whatever condition you may be facing. We like to do a root cause analysis, if you may put it that way. Because if we know exactly what's behind something, then we can ultimately together come up with a solution. I mean, my patients are the best. They're the best tool I get to work with because they give me through their story. They give me exactly what's going on, and that's where I start from. And together we take a shared decision making in helping them optimize their wellness. So some misconceptions may be always, it's too late. I can't start. Oh, my genes are this way, right? We sometimes want to blame it on the genes. Yeah, there is a bit of that, but I like to think we always have a choice. It starts with a choice. We have to make a decision to really take charge and take control. Yeah, maybe there's an immune condition that's going on, and our cells, our bodies are reacting to something. But I always like to empower my patients that it's not ever out of their control in one way or another. There are things that we can't deal with, but we can do our part. And I always like to educate my patients, but they educate me too in letting me know what's really going on.
That's great.
Yeah.
That's really good. I like that. So, looking at your website, it highlights services like weight management, hormone therapy, and IV hydration. Can you walk us through how these services contribute to overall wellness?
So again, thank you. Thanks for that question. And that's always something I like to discuss with our patients. Certainly, nutrition, I always go back to that, the things we're putting in our bodies, right? Hydration, especially for us here in South Florida. It's easy to get dehydrated, or maybe we're working hard, maybe even like, say, for example, you're a nurse and you're working hard. You don't even have time to pause and use the bathroom, but ultimately our bodies, let's think of them like a car, right? um, that machine or that engine needs to be well oiled and fueled in order to be able to function optimally. So that's where hydration's coming in. Now, if all we're drinking is just water, we need those electrolytes. That's where that nutrition bit is important. Okay? So all of those things ultimately work together to help our bodies function optimally. Now, I'm also board certified in obesity medicine. You asked about weight management. We see mainstream. There's a lot of things out there in the market of, how to lose weight, but it's not everyone, it's not a cookie cutter approach where everyone should take this medicine and they will be okay. Is that an appropriate treatment for you? Is this what your body needs? So we always like to go right from, your hormonal balance or imbalance, your electrolytes, what do those look like? Your organ functions, how are your kidneys, your liver are working? And so the different medicines get to be processed through our bodies from the different organs. So if, say, your kidney is not working well, it means the medication that has to go through the kidneys is not the appropriate thing for you. These are things we can't know from just looking at you at face value. So we always like to do our diagnostics, make sure we really know what's uniquely your body's condition. That's always where we like to start. As far as, the weight management, as we have extra cushion or the extra fat, this is where we have extra cholesterol or higher cholesterol, which then clogs up our pipes that take blood, which takes oxygen. So as we have extra cushion or extra padding, if it's not allowing our organs to move well because it's causing pressure on that, that's really where we see chronic conditions come up. So if I can fix one thing, help someone take charge of, say, the weight, which helps the other organs function better, ultimately we're using one stone to kill several birds, is how I like to think about it. So again, a core part of our approach here at My Health and Wellness is to really delve into what the root causes to help our patients, our community to bask in their health and wellness. So that's our goal here, just optimal health. It's not enough to just have health. If anyone's a believer, abundant health is what we need to have, and we deserve it. So which, if we work towards it, we should be able to enjoy it and not be, unwell or kind of feel trapped in our bodies. They are machines, and once we activate them, it's amazing the wonderful things our bodies can do to kind of push us on and help us live longer.
Now, let's say our average listener is listening to you explain the different approaches and plans that you have to wellness, and they're new to this, and might be a little bit overwhelming. So where would you recommend that they start? Are there any specific services that are particularly popular or impactful?
We always start with a consultation. And that's the key part where we want to find out what is going on with you. A great place to start for us here is just like you fill out a survey, we have a treatment builder tool where you just tell us about you, and you can do that even well before you come in to see us. We will go ahead and share that information. If you ever reach out to us, we'll share that. So after we get to know more about you, we want to do a deeper dive. We always want to do a diagnostic study. Physical exam is one way for us to know what's really going on, but also checking your labs to know what's your hormones like, what are your organ function like, and then we customize a plan that's good for you. So that's always a good baseline that we always start with.
Can you share a success story or an example of how My Health and Wellness has helped a patient achieve their wellness goals?
Yeah, certainly. One that comes to mind already is We had a gentleman that was just visiting through, is here in South Florida on holiday, and he has a cold or cough that's just not going away. So we have him walk in, and I just stick with him, and it's just I feel okay. It's just this thing that's been lingering. We go ahead and just traditional. We examine him and go ahead and get just the baseline EKG is where I uncovered that this gentleman was actually had a heart attack. Even though it didn't look like it from the outside, but because we like to be thorough and not just look at you from the surface, we ended up connecting him with a very good friend, Dr. Bernard Ashby, is a well-known cardiologist here in South Florida, and he took care of him. And before we knew it, a few days down the road, he got the care he needed. He needed a heart cath, but we followed this patient even after he was here. So starting off with us being thorough, picked up what was going on, followed him through, literally coordinating him to a colleague, and followed him through the hospital as well. That's kind of the care we like to make sure our patients have. So he's just one story. I think of him because he's someone that had no idea this was going on. And it didn't look like it was going on until he got a chance to get the care he needed without being in an emergency sort of situation. So that's just one of those stories. But the many I've taken care of, essentially, I just want to lose weight so I feel better. Before we know it, they're off of diabetes medicines and blood pressure medicines. They're walking more, getting to walk with their dog, getting to enjoy time with their loved ones, showing up for birthdays and events because now they don't have to deal with, urinary retention issues. Those are just a few of the transformative things we've been enjoying sharing with our patients. So, yeah, we're really excited to be here.
Great. Now,
Yeah.
with so much information out there, especially social media, everyone's a guru. Every influencer is a guru on health and wellness. How can people distinguish between credible wellness advice and trends that might not be effective or even safe?
Whatever is out there in social media is just that. It's social. You want care for you as a person, as a unique individual. That's where I think, whatever we're listening to, there are too many options. Even as clinicians, oftentimes we recommend things. You just go to CVS, you find a whole bunch of options, right? I say you are a unique individual. You are fearfully and wonderfully made. You're unique as a person. Make sure you get that unique evaluation for you. Don't do something just because it's on social media. Maybe it's not what your body lacks or needs, right? So we like to treat people as unique individuals, and that always starts with that inner look with a consultation to evaluate you as an individual. Yes, you're not a standalone. We've got genetics, we've got histories, but let's take a look at you as a person. How do we empower you, your very unique body and your very unique organ system to function optimally to serve you well? Not just what everybody else is doing, because we are all spatial beings. So that's why we should expect spatial treatment as individuals. So, yeah.
Great. Now, you seem to be you don't seem, you are very passionate about what you do. And what I appreciate about this interview is that you've turned this more into an educational topic. And a lot of times a lot of providers would like to, sell a service, but you're more in tuned with educating our listeners and just educating the average individual. Do you host any community events or workshops to promote wellness education? If so, how can listeners get involved?
This is something, great question, by the way. This is something we're very excited to start launching, especially this year. We'll be doing some educational videos to just let folks know about what it is that we do and educate more. But for starters, coming in to see us is one great way to get to know us and learn more about us. But yes, we will be putting out more content on our through our Instagram. We'll be posting more videos to educate our patients or those who would like to come out and see us. We are always a phone call away, and consulting in order to really treat that person uniquely, like I was alluding to earlier, is something that's near and dear to us. We want to meet you. We hope that you go ahead and take a look at the materials we put out there. We've sent out a lot of things in the mail, but we will be doing more of those videos to educate. But there's nothing better than you as an individual sitting here with me for a consultation. We cover what it is that is bothering you and how we can be a solution. That's what we're here to do. We don't want to sell you anything, but offer you solutions. So that's all we have here. Offers and solutions for your unique problem.
Now, you do have an event coming up this Friday that's like an open house for My Health and Wellness Medical Group. So if you could share a little bit about that in 30 seconds as we are about to wrap up the show for consumers, for the listeners, if they want to participate.
Certainly. So right here at our clinic location at 400 West 45th Street, off of Sheridan and 41st here in Miami Beach. We are in Suite 103. If you can come out Friday that's going to be February the 7th, from 10 o'clock until 4 p.m., we will have our doors open for the community to come in, and we'll share a link for you to reserve your spot. So when you come, we actually have time to try and do a demonstration for you on some of our innovative devices we have here. We are glad to have you. So it's this Friday, February 7th, 10 o'clock to 4 p.m. We'll be doing a demo day, show you what innovative solutions we have. So we'll share information for you to make sure you book a time slot and come on out.
Perfect. How can our listeners connect with My Health and Wellness Medical Group or schedule a consultation?
So our phone number is a great way to reach us. That's going to be 305-720-2288. That's our main number. And you can also call us to reach us at 305-979-8855. That's the easiest way to get a hold of us. Otherwise, on Instagram, it's MHW Medical Group.
Perfect. Thank you so much, Dr. Nambusi, for sharing your expertise with us today. It's been such an enlightening conversation. Thank you. And to our listeners, if you are interested in learning more about My Health and Wellness Group, please visit their website, www.wellness.mhw-medicalgroup.com. And
yes, thanks for having me.
You're most welcome. You are listening to Chat with Kat on WSRF 1580 AM and 99.5 FM. We look forward to having you guys listen to us next week. Have a great rest of the week. Thank you so much.
Yes, be blessed.